Hello and welcome. This will be a short introduction to crisis intervention. My name is Dr. Navid Iqbal, and I will be telling you a little about how to handle crisis and crisis situations when people call in. There'll be a slideshow running so you can have that information. First of all, I would like to start telling you that this is by no means a comprehensive approach. This is an overview, something because we'll be running a helpline and just need to assess people on a very quick terms and kind of band-aid what they're doing. So with that said, we'll move on and hopefully I'll try to give you some information where it will help you manage people who are in active emergencies or crisis, psychological emergencies or crisis. So first of all, let's go and see what the definition of a psychological crisis or is. So here it says an individual is said to be in crisis when the circumstances overwhelm their capacity to cope. So very basic thing where someone is not able to deal with the stress. कोई बहुत ज़्यादा परेशान है उनसे हैंडल नहीं हो रहा सिचुएशन तो वो एक क्राइसिस है. Let's see some examples in the next slide where we talk about what could be some of the crises that people encounter. Once again, this is not a very comprehensive list. It's just some of the things. So first of all, when you think about crisis, the first thing that comes to mind is someone who is suicidal, who is thinking of hurting themselves and or someone else. Once again, with this being said, this is not very common. Hopefully, we will not get a lot of these people who are actively suicidal. There's a difference between someone who self-harms or self-mutilates, whereas they're doing it for whatever reason there may be, but there are people who are actively suicidal. Someone who has a plan, someone who says, I'm going to go jump off a building after I end this call. That is a crisis. Okay, so someone who is out of touch with reality, exhibiting bizarre behavior. So let's say someone's friend died and they're now thinking, okay, I'm going to go kill myself, or they're not going to school. They've stopped doing things of everyday, like their everyday activities. So that person is in crisis because they need immediate help. Extreme nervousness, confusion, sadness that begins and to hamper their everyday activities. Once again, that's the key. Excuse me. If they're not being able to control or handle their everyday activities because of these symptoms, that is when we need to intervene. Okay. Third is uncontrollable behavior that is upsetting others. So sometimes people who are in crisis or people who are going through something really traumatic, they don't understand the real extent of their problem, and this can be assessed by other people. So other, like family would say, हमारा बेटा 6 दिन से नहाया नहीं, कहीं पे कुछ जा नहीं रहा, वो ulti baatein kar raha hai. Things like that. You can get all this information from different sources. So sometimes someone would call in to the helpline saying, our son is doing this, my husband is doing this, my daughter is doing this. So things like that, where someone else's account can also be used to understand the state of emergency. Okay. Finally, there's someone who has a drug problem, substance abuse problem, or overdose problem. So those are emergencies. Someone calls you saying, a concerned mother calls you saying, our son smokes cannabis, hashish. So they're like, he smoked a whole, like 4 cigarettes of hash-filled cigarettes. Now, is that an emergency? Is that a crisis or not? Thankfully, and that's a debate for another, substance abuse is debate for another topic, and hopefully that'll be covered. But we know that hash, if it is hash or cannabis, an overdose is not really possible or not lethal. So that's not an issue. But if someone is like, you know, our son or our daughter took 14 tablets of Xanax or Alp or whatever, so that might be an issue. So you need to then intervene. So that's what a crisis could be, some of the examples. So let's move on to the first thing. This slide is very important where we talk about you need to assess if the patient or if the client is in imminent or immediate danger. Let's say, once again, the example of someone saying, I'm standing on a rooftop and I will jump. Yes, that is immediate danger. That person could harm themselves. Or if there's a mother, let's say, going through uh, postpartum depression or psychosis, and she's like, I'm going to strangle my child, that is an immediate problem. That's a crisis. So the first thing is, if you are encountering something like that, call for help. Call other people, keep that person online if possible, call your counselors or your seniors for help. There will be details given to you for who to contact in such situations. Call them no matter what time of the day so that they can help you assist and get that person assistance. Okay. Um, Next up, we go to approach that I'm going to teach you is very simple. It's called rapid. So that's the mnemonic. So R is for rapport and reflective listening, A for assessment of needs, P for prioritization, I for intervention, and D for disposition. Okay, let's go over one by one what these mean and really quickly summarize what the approach should be. So first things first, we go with rapport and reflective listening. Very self-explanatory. You have to listen and build a rapport. If the person calling you is in distress, they need to confide in you. They need to know that they can talk to you. They need to know they're not being judged. They need to know most of the time people call because they just want to be heard. And you can prevent a lot of crises such as self-harm just by listening to them. So reflective listening is, okay, you show them that you are actively paying attention to what they're saying. So let's say, and you tell them, repeat things after them. So let's say, so you are saying, so उर्दू में अगर आपने कहना हो तो अच्छा तो आप ये कह रहे हैं या आप ये कह रही हैं, अगर मैं आपको सही तरह समझूं तो आपका कहने का मतलब है. Things like these phrases, they sound silly, but they build rapport. They tell the other person that you are listening and you're confirming what they're saying. Sometimes people would say something which they really don't mean, but when you ask them that if that's what they mean, then they might change the answers. And then comes something which is very important, that you ask directly, how can I help you? आपने फ़ोन किया हेल्पलाइन पे, आप हमें बताएं कि हम आपकी किस तरह मदद कर सकते हैं. ठीक है. So that sometimes that will, bring out the solution for them. They would be like, I just want to be heard, or I just want someone to listen to me. I just want someone to validate me. मेरी कोई बात सुनता नहीं है, मुझे चाहिए कि मैं कोई बात सुन सके. So things like that. Just make sure you do that, and once again, summarize, paraphrase, repeat what they say, and ask them to confirm that. Um, Finally, and this is very important, do not give any advice or try to fix the problem. It's generally in therapy, that's the rule in any disorder, but especially in a crisis situation or a crisis intervention. Someone comes in, they tell you कि मैं अपनी बच्चे लेके अपने हस्बैंड को छोड़ के जा रही हूँ. You don't go like आप ना जाएं. Yeah. Yeah, someone saying that they're in an abusive relationship, you don't be like, well, deal with it, or आप छोड़ के चली जाए. That is not your role, especially not early on in the conversation. where you don't have to give them that information right there and then. Your role is to highlight what they can do and help them reach a conclusion and a solution rather than giving them solutions that you think would help. Okay, I know it's a little difficult. People sometimes might be like, आप क्या करेंगे, आप मुझे बताएं, मैं अगर आप मेरी जगह होते. You have to dodge that question. Okay. Moving on. Second, the A for rapid is assessment of needs. We need to figure out what people want at that moment. पिछली slide में भी हमने ये बात की थी that you need to listen. And that's why I've highlighted it 3 times in this slide, that you need to listen, 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 and assess what people need. Ask them directly, पूछें आप आपको क्या चाहिए हमारे से, हम क्या किस तरह आपकी मदद कर सकते हैं. That would open up the door for a lot of things, and people might tell you directly, I think मुझे ये चाहिए. मुझे कोई बताना, अक्सर लोग कहेंगे कि मुझे कोई, मैं चाहता हूँ या मैं चाहती हूँ कि मुझे कोई बताए कि सब ठीक हो जाएगा. That's fine. They just need to know that life moves on. It's not the end of the world. And you just need to tell them and convey that to them in a very polite manner. Okay. Once again, assessing how bad the situation is. If someone says, I feel the urge to hurt myself for 2 years, but I have not done it, then our assessment of their needs is that they can get help soon, but they're not definitely or most probably going to hurt themselves. अगर जिसने 3 साल में नहीं किया, they have chronic thoughts of suicidality. They are not at that big a risk. If someone says, I have a plan, I bought a knife, and I know रात के 2 बजे when everyone's asleep, I'm going to put a tape on my face, and then so that I don't make any noise, and then I'll cut my wrist. That is a bigger threat, and their needs are more urgent to be addressed rather than the case I gave initially. So just assess the needs of the patient or client. Then comes prioritization. Give the patient, let the patient come up with a list of things that they need to do. So आप उनसे कहें आपको इस स्टेज पे पहुंचने के लिए क्या क्या चाहिए, ठीक है. When last point में in the assessment of needs, we've identified what they need. Now we have to come up with a clear plan. Things like, if you keep on taking the same example of someone wanting to hurt themselves and they've got a knife, they've got this and that, everything ready, we need to first diffuse that situation. So in the priority list, the first thing would be get rid of the knife. Tell someone, inform your parents so that they can come and do it, and inform someone else if they can't inform the parents, someone who can be there for them. Then the next step would be to get help. If someone's saying that, yeah, they're going to do it tonight, we can't be like, you need to go see a psychologist in person, because that is a second or third priority. First priority would be to get them to safety, to get them to not do that act. So we need to prioritize our plan. Then comes intervention. To be honest, as I talked earlier, sometimes or most of the times, reflective listening and telling the person that it's going to be okay, that they're heard, they can reach out to you, is all people need. But majority of our job would also be to identify and point out resources and help them write a plan. And I emphasize on the writing bit, because people come up, especially when people are distressed, they come up with all these different ideas, and they're like, and that can be overwhelming for them because they are already thinking a lot is going through their mind. So a better idea is to make them get a pen and pencil, paper and pen, and then write it down. Write down what they want to do. The plan would be, I will get rid of these things. I'll look for a therapist in person. I'll go to a psychiatrist. So as we assess the needs, if we know that someone has major depressive disorder, or someone is going through adjustment disorder, whatever, and we think that they fit the criteria of seeing a medical physician or a psychiatrist, then, or if we think that they'd benefit from medication, even the slightest chance of that happening, we uh, ask them to see a psychiatrist. बहुत सारे लोगों को ये नहीं पता होता कि थेरेपिस्ट क्या है, साइकोलॉजिस्ट क्या है, और साइकाइट्रिस्ट क्या है. Most of them would come to a psychiatrist when they should really be in therapy. And some people are unfortunately in therapy for way too long and are afraid of going to a doctor to get medication. So we need to clear those things as well, clear the misconceptions. We need to clear the stigma as well, that no, you're not in quote unquote pagal, or you're not abnormal. A lot of people go through this, and if you need help, you need help. Like if you need help for diabetes, go to a doctor. Same for mental health problems and things like depression. So just clearing that and making a plan with them is choosing the intervention. Okay. At the end is disposition. So we need to finalize what that plan is. So we came up with interventions and then writing down what they should be doing. So if they need a follow up, if they promise you, one thing that works is asking people to promise you. I know sounds a bit unprofessional, but in crisis management is one place that you can do that, because the people are in such immediate danger. If you make them promise you, especially in cultures like ours, where people are more inclined to stick with their word, or if they give their word. So just make them promise you that they will not do that tonight and think over it tomorrow, and then reach out to someone. So make that promise and then schedule a follow up if you think that's necessary. If you think they're at immediate danger, schedule a follow up pretty soon. Let's say the next morning or later that day, where they call you again and check with you how things are. Okay, that's one thing. Instill hope. That is one of the most important things that one can do for a patient or a client in such situation where they're so desperate that, let's say, they want to end their life. You try to instill hope in them, because no matter how bad things get, there's always a way out. And if you fight, if you work towards it, you can find that way out. And that's what we want to do with them. That's what we want to tell them, that here, things are difficult right now. I know it's difficult, but let's see how you feel in a couple of hours, in a couple of days, in a couple of weeks, where things get better. Tell them statistically, tell them, I have talked to people in your situation who have now looked back and they kind of, think they take this whole experience positively and they have changed their life. And there are a lot of people who do that on almost daily basis around the world. So that can be something that you can tell them. Finalize the plan, review it with the client. उनसे बताएं जो उन्होंने लिखा था, if they wrote it down, go over it, and that's it. Once you end the call, it would be important, and these forms would be given to you to record everything because of legal and even ethical reasons, so that if anyone comes up to us, or if we know what we did or how we tried to help people. So there'll be forms that would be given to you. If until they're not given, and if you get a case, write down all the information in detail you can on your own, and let your supervisor know about the case. Okay, so that was it. I know it was a little longer than it should be, but hopefully this gives you a better idea on how to talk to people who are in crisis, and we will take it from there. You can email me at navid@umang.com.pk if you have any questions regarding this. And I wish you all good luck.